So a very common problem that we face in our otology clinics is vertigo. I always challenge patients when they say their diagnosis is vertigo to say that vertigo is actually a symptom. It's not a diagnosis in itself. And there are two different types of vertigo. There's vertigo related to the balance system or vestibular system, and then there's vertigo that's related to just other physiological processes in the body. So a good example is one of the leading causes of vertigo in women over the age of 40 is cardiac arrhythmia. That has nothing to do with the inner ear, but everybody believes that vertigo is essentially an inner ear problem. So when people come in for vertigo, we take a very comprehensive history. Once we've ruled out some of the other general body causes of vertigo, such as cardiac disease, low red blood cell count, for instance, then we try to narrow it down to say, okay, if we believe this is the vestibular system, is it a central vertigo problem, or is it a problem related to the inner ear, which we would call peripheral? So good examples of central problems would be migraine-associated vertigo. Migraine has been termed a headache syndrome, but in reality, migraine is a neurophysiologic response in the blood vessels of the brain, and it can produce any different type of symptoms related to those structures. So for instance, you can have visual changes with migraine. You can have vertigo with migraine. So that's a good central reason. Other central reasons: acoustic neuromas, strokes, multiple sclerosis or demyelination of the nerve fibers. All of those issues can lead to a spinning sensation, a sensation of imbalance. So now if we say, okay, we don't think it's central, we do think it's a vestibular system, then it becomes an issue of the inner ear. And the balance system is really, we've talked a lot about the cochlea on the website. That's where we have hearing, but balance is really on the labyrinthine side. So these semicircular canals are positioned at 90-degree angles. So any head movement you make, it will sense the movement. The primary function of the inner ear is to keep the retina of your eye on target. It's to actually keep your vision stable. You also have what we call otoliths, and they deal with linear movement, and they deal with gravity, which helps us to stand upright and keep our head straight forward. If it's anything related to this inner ears, we can usually ferret that out through a good history. And good examples would be benign positional vertigo. That's the vertigo you get when the crystals from the central portion of the ear that deals with gravity get loose and they drift around in the semicircular canals. You typically would describe rolling over in bed and having a 45-second to a minute spinning episode that then resolves. But then when you sit back up, it recurs again but goes the other direction. That's benign positional vertigo. Labyrinthitis, where you have a cold or a flu or a sinus infection or urinary tract infection, and then a week later, bang, you wake up when you're spinning. You spin for about a week, it slowly resolves, you don't feel quite right, and that can last for a couple of months, and your hearing is normal. That's what we call vestibular neuritis. So inner ear problems are probably the least common of all the problems I've mentioned that cause vertigo. And if you were to walk into most primary care offices or most emergency rooms, everybody who has vertigo has an inner ear problem until proven otherwise. And I think our challenge is the majority of people don't have an inner ear problem. And what we will do is we'll do a hearing test to be sure that the hearing is stable, that there's no asymmetries that could indicate something like a multiple sclerosis or a stroke or a acoustic neuroma. And we'll also do a very solid physical exam, which includes the vestibular system with specific testing. And for those that we're still trying to sort out, we can order laboratory testing, which will be called a VNG or a video nystagmogram, a rotational chair test, a tilt table test. We can get all of that laboratory work done at some of the centers around us. And that would just help us to make the diagnosis so that we could really prescribe the best treatment. And I think paramount to most balance disorders is the value of physical therapy to help people to overcome the deficits they obtain through their imbalance and to help them to actually cope. And in a lot of cases with vertigo, we don't cure it. We can identify it, we can tell you what we think it is or what we don't think it is, and then it's a matter of coming up with a program to help you to live with it.